Welcome to the questions on spinal degeneration. So let's get into this because this is hugely important. Now, some of the questions that we can't answer because of the political climate that the social media has, they're going to be on the Dr. BVIP. And let's get into this. Now, question 1 from Spandel 100. I was in a very bad car wreck, speeding a 9-ton truck, hit my driver's door right side, broke all my right ribs back and front, shattered my collarbone, damaged my lung. X-rays from the side, not the back, showed spine curves and a slight C from the impact. Boy, I would imagine. Would that type of curvature respond to exercises? I've been on a high nutrient, whole vegan diet for years. I'm telling you right now, you got an angel on your shoulder. I mean, to survive something like that, you got a purpose in life. God bless you. And anyone that recovers from a trauma like that is going to be able to identify with people that have had similar issues. So surprisingly, even though that trauma is life-changing, it's probably changing your life for better experiences. I know it's crazy. Exercises will, but what happens when you have a trauma, and this was huge. I mean, you were so lucky to be alive. When you've had that type of trauma, their force loading will literally distort the segments of the spine. But that's also going to change how the pelvis works and how the brain works and how the lumbar works and how the feet work and knees work. So you have to look at the entire spine. Even though the majority of the fractures were in the thoracic area and the collarbone, you got to know that neck and everything else was affected. So look at your automatic nervous system. One part keeps you alive under stress. The other part regenerates tissue. If you have an autonomic dysfunction or a chronic state of stress or a chronic subluxation pattern, destabilizing the cervical and pelvic area, which I'm sure you do have, that means resting, digesting, and repairing are going to be a challenge. Whole food vegan diet for years. Hopefully it's all organic. The old joke I used to use is a Diet Coke and a Twinkie is vegan. Don't. Yeah. That's. I know you're not in that. You're eating better food, but that's like a standard thing. So it's not just the diet; it's what you can absorb. And if you're in a chronic state of stress, you're not going to get the absorption. So this is how you get it corrected. First, you need static and stress x-rays. This means you get an x-ray of the side of the neck, then you get a stress x-ray as far as you can get that in extension and see how the vertebral segments move. With that C-shaped deviation in the thoracic area, you need to isolate that thoracic area in a weight-bearing fashion where you're standing up and bend that body off to the side to see what is moving, what's not moving. Now, knowing that you got altered biomechanics of the thoracic area, we know the lumbar is going to be compensating and the pelvis is going to be compensating. So first thing I would do in our offices is I'd say, take off your shoes. And if I see a lateral deviation of that big toe, that means that there is going to be a pelvic issue or lumbar issue. And that means the foot are flattening out, a bunch of different altered biomechanics when you walk. So look at the entire structure. I would give you specific ligamentous-based exercises based on the static and stress x-rays. So restoring the curve in the neck will de-stress out the thoracic area. Restoring the curve in the lumbar. So look at our pelvic health videos. And so this is going to de-stress out the thoracic area. Now, if there's so much scar tissue in that thoracic area from the multiple fractures and there's no lateral bending, you can see if you can distract that spine. This is why I would recommend getting in a prone position on a table that can distract. It's called flexion distraction, where you're opening up those joints. And then you can actually see, because if you can get motion in the joints, you get nutrients in the joints, and nutrients in the joints means the disc can regenerate. So the exercises that I would recommend are the ligamentous-based exercises to restore the lumbar curve and restore the cervical curve. That'll de-stress out that thoracic area. Then, once you're correcting the area above and below that thoracic area, then you can start to get that area corrected. And again, it's ligamentous-based exercise. We would put a hard foam piece on your side and have you lay on your side, but have your head supported and your pelvis supported, so you're just getting that lateral deviation there. But I would not recommend that unless you're getting the cervical and lumbar corrected. So look at the entire spine, and then that will show you where your body is adapting from that trauma and how much you can correct that trauma. And I've seen injuries 30, 40, 50, 60 years old, and there is mobility and you still can correct it. So get to a good chiropractor that's going to do pre and post x-rays and that is going to address the real problem, and also check to see if your feet have bunion formation or beginning that deviation, because that indicates a pelvis and lumbar issue. Then even with the whole food, vegan diet, which it's easier to get proteins out of plants, you still may have an absorption issue too. So look at sleep patterns, look at bowel movements, look at everything. And you can recover based on the static and stress x-rays and what the chiropractor is going to find for what mobility you still have in that thoracic area. Question 2 from Amaya 12. Can one with osteoporosis have chiropractic treatment? Eating healthy plant-based diet, started doing exercises, taking marine calcium, D2, magnesium, lordosis, and scoliosis. Strong dorsal curvature, 61 years. Yeah, 61 years old, you're still a kid. Okay, we're supposed to go to 120. Look at osteoporosis. Has the body adapting to blood acidity. I know it sounds crazy, but when you're in a stress state, and you only have 3, physical, chemical, emotional stress, those stressors decrease blood supply to the gut because it puts you in that fight or flight system. The rest, digest, and repair is secondary. Now, your body alkalinizes through 4 different pathways: respiration, perspiration, bowel movements, and urination. I say poop and peeping. So if you are in a stress state, you're missing some of those. Either you're not perspiring, you're not doing a lot of deep breathing, maybe 1 bowel movement a day, or it's watery stools, or, when you're looking at those detox pathways. So what happens if the blood becomes acidic, and you got to maintain that pH level of that blood in a very, very narrow range, talking 7.35 to 7.45. So, a couple of tenths of points above or below that, you're not here. So the body is going to go to the bone bank if you have a problem with respiration, perspiration, bowel movements, and urination, and withdraw calcium. So if you look at osteoporosis has an absorption issue from chronic stress or low stomach acid, because you need stomach acid to absorb the minerals, or blood acidity, then the body is going to reverse that osteoporosis by restoring the normal function. So it's not just taking in calcium. You got to look at the stress levels and look at sleep patterns, look at all of that function. And then, the lordosis and scoliosis, how to correct that, you need a static and stress x-rays. So static means you're standing up. Stress x-rays mean you're bending to one side and bending to the other side. And if that scoliosis doesn't change on bending, and we bend it hard, if it doesn't change, then it's stable. It's not going to be moving. If it does change, then that's the minimal amount of change, minimal, not maximum, minimal amount of change that the chiropractor can get. So make sure you get to a chiropractor that understands what static and stress x-rays are and how to do a post x-ray to document the changes. Now, to correct scoliosis, what you're going to see, one of the main factors is to restore the lordosis, and that means the cervical lordosis, the lumbar lordosis. You restore those normal biomechanics, fantastic. But you also have to stabilize the pelvis, because remember, the pelvis and the cervical spine are where that parasympathetic, the rest, digest, and repair is. So with osteoporosis, you're having a problem resting, digesting, and repairing. Okay, so it's a bone alarm, not a bone problem. And then there's certain medical medications that can affect it that we can't talk about on this venue, but we can talk about on the Dr. BVIP. And the strong dorsal curve means you actually have a thoracic issue. and the body is rounding over to de-stress out the nerves, because the nerves come out of the back half of the spine. And when people are distorting off to the side, they're generally de-stressing out that central nervous system. And that usually is from a loss of curve in the neck, loss of lordosis in the lumbar, and this is the body adapting. That's why you got to look at the whole spine. I'm talking pelvis, lumbar, thoracic, cervical, static and stress x-rays, and then you got good data at what can be corrected. Question 3 from Patty Kelly, 5600. My chiropractor says my vertebrae are so close together that my next move is surgery. Can that happen? Okay, if the chiropractor is utilizing static and stress x-rays, okay, then he can say that there is motion or there isn't motion, because the discs get their nutrients through movement. And there is a horrible blood supply to those discs because they're under such a great force loading. So they get their nutrients through imbibition, which means movement. And you're going to get that movement, and that allows the nutrients to get into the disc. Now, when you look at a disc, you can see, or the side view of the spine, you generally can see it. There's a space. However, if there's a lateral deviation, the space may still be there, but you may not be able to see it. So if you're just taking the standard static x-rays from the front, from the side, you may be missing that there is still motion at the disc. So the chiropractor may be working with incorrect data. And so get to somebody that does pre and post x-rays. To recommend surgery is, to say it's the last disc resort, surgery is not very effective at correcting spinal issues. And if you have compressed discs, say in the thoracic or lumbar, by restoring or moving, mobilizing, and changing the position and motion of the vertebrae above and below the damaged segments, you can de-stress out that area. So conservative care is always, always better than going in and doing spinal surgery. Because, I mean, in 28 years of practice, I've referred 4 people for surgery. And this is out of tens of thousands of people. So it is needed in a very, very, very small percentage of cases. But without the right data, without the skills of the chiropractor to do a series of adjustments, take a post x-ray, document that you're fixing the structural and neurologic changes, changing the physical, chemical, and emotional stress load so the body gets the right nutrients to regenerate, then you got the best chance of avoiding surgery and regenerating the discs. But the chiropractor may be using poor data. Question 4 from Indra Beer 1272. I was diagnosed with spondylolisthesis, and I do agree with you that I've had a trauma in the past. Today it's difficult for me to walk. I live in constant pain in the lower back, hips and thighs. I know something is pressing on the nerve. What to do? Excellent question. When you look at spondylolisthesis, it just means that there possibly was a pars fracture, and that's the back half of the lumbar vertebrae. And this is where a lot of doctors get messed up. They'll see an anterior listhesis, and typically this happened usually when you're in the teenage years in a hyperextension injury. Now, just because you have that anterior listhesis, it is going to change the biomechanics, but it may not be the main source of the problem. But doctors are known for this. Ow, hurt here, look there, anterior listhesis, that must be the problem. No, with a long-term fracture, and that's what an anterior listhesis, you have to have a pars fracture in order to have that, or severe ligamentous instability, if it's grade 1 or less. But to get more than a grade 1, which means it slid further, there is going to be a pars fracture or some type of fracture in that area. So that's going to cause the body to adapt above and below. So you can reposition that. And we do this all the time, taking that bone that slid to the front and you can move it to the back by adjusting the area below and above, and then de-stressing that out on a lumbar flexion distraction and then lateral flexion so you can restore the nutrients to the disc above and below that anterior listhesis segment. By correcting the lordosis, in the cervical and the lumbar, de-stressing out the thoracic area, stabilizing the pelvis. And this is one of the biggest problems I have with a lot of chiropractors that don't utilize x-rays, or physical therapists that just work on the muscles and try and stretch everything, which I mean, both are effective in a lot of different cases. But when you have an anterior listhesis, it's not a muscle problem. You're going to have all the muscles of the pelvis tightening up, such as the piriformis, the plexors. All of these muscles are going to be tightening up to stabilize that pelvis, because there's no muscle that crosses the back half of that pelvis. And this, if you have that antilisthesis at the lower lumbar, which you more than likely do, then that's going to cause the pelvis to alter. You're going to see the big toe is going to be leaning towards the other toes. The foot could be flattening out. Calves are going to be ultra tight, changing your gait, stabilizing the pelvis. Get static and stress x-rays of the lumbar, thoracic, and cervical spine. Stabilizing the pelvis using a trochanter support. Taking care of the biomechanics of the feet, the calves, the knees, everything. You got to restore that arch of the foot. You cannot restore the arch of the foot without stabilizing the pelvis and correcting lumbar issues. So even if you're addressing the area above and below that spondylolisthesis, then you are going to help your body. And by correcting the biomechanics of the feet, the calves, and the knees, the corrections that are done to the spine are actually going to be fantastically effective in de-stressing out that area. Then if your chiropractor is doing the same force loading, and this is the key, when the patient is in the prone position, in the side posture, and in the supine position. So in an anterior listhesis, this is going to sound kind of like a football play. You do an anterior A to P lumbar adjustment with lateral flexion. That means you are laying on your back. The chiropractor lifts you up, bends you off to the side, puts his hand down in the lumbar area, and drops. So that force loading is from the front to the back, but also taking into account any lateral deviation of that spine. But that is just one of the 3 adjustments that we would do based on the stress x-rays, based on what is moving and what's not moving, and then stabilizing the pelvis. Typically in anterior spondylolisthesis, it's gone anterior, and we're going to be stabilizing the pelvis, not adjusting the pelvis on the typical person. And you can get better. You got to get the static and stress x-rays, get to a good chiropractor that's going to do pre and post x-rays, and have that chiropractor, when they do address the feet biomechanics, calf biomechanics, knee biomechanics, stabilizing the pelvis, looking at the cervical and thoracic force loading, because if that area is off to the side, you're going to have altered biomechanics. You got to address everything. Question 5 from UZMAYUNIS6343. I have psoriatic arthritis from 10 years back. I take vitamin supplements and take homeopathic treatments. Avoid junk food, exercise regularly, but I still have strong pain. Doctor gave me Humira for arthritis, but I know this medication is not helping. I live in Norway where weather is very cold and my joint pain is worse in the winter. What's the solution? My relatives came from Sweden, brother. Or sister. Let's get you healthy. Okay, my family. Psoriatic arthritis has to do with toxification of the body, decreased stomach acid, and this is going to have skin issues as well as joint pain. So it ultimately means that there is some toxicity to the blood. Now, when you're getting this corrected, and I mean corrected, the reason cold weather, and it's not really cold weather, look at every joint in your body has hydraulic. It needs fluid. And the joint gets its fluid from blood, and then it creates this superfiltrated blood called synovial fluid. Around all the tendons, you got bursa sacs and bursa fluids in there. So if the blood is thick from physical, chemical, or emotional stress, it can't filter out. Type 2 diabetes will do that too. And I know, avoid junk food, regular exercise, you don't have the diabetes. But we want fluid to flow into those joints. So you got to look ultimately at the physical, chemical, and emotional stress loads. Physical stress, static and stress x-rays of somebody a chiropractor or some professional that's going to utilize that to guide their care, not be specific that you're going to be holding to those adjustments, because the ultimate goal is to change the position, motion, and communication or proprioceptive aspect of that spine to the brain, and then that brain can start to regenerate the body healthy. So the physical stress is going to be taken care of by stabilizing the pelvis generally. If you have an unstable pelvis, and I'm pretty sure you do, particularly taking certain medications that can weaken the body's ability to regenerate tissue. And that's as much as I can say on that in this platform. It's crazy that I can't speak out correctly. But with freedom of that whole speech thing. But when you're looking at correcting this, you got to get the blood healthy, and the blood, every cell is brand new every 120 days. So the thickness of the blood you can identify on a live blood cell analysis. And that live blood cell analysis will show you, because under stress, the cells start to clamp together and they can't filter out into the joints. So look at this as a stress response. So you've got to address the physical stressors by addressing stabilizing the pelvis more than likely and correcting lumbar and thoracic and cervical issues. Then change the sleep patterns. That's going to be huge. Now, you're in a sympathetic dominant state, a stress state. So anything you do to the organ tissues, such as the gut area, gets you in a more autonomic balanced state. So look at resting, digesting, and repairing. Look at changing the sleep patterns. Look at our sleep restriction videos. Mastering the emotional component. Because, for 10 years, you've had joint pain, and there is going to be an emotional component. We recommend neurolinguistic programming, but there's also emotional freedom technique, the tapping technique. There's a lot of techniques that you can use to address the emotional component. And then you're going to be set. And don't worry about the cold joints, because when you figure when the weather changes, there is literally a lower pressure system, which means under normal weather conditions, you have a certain amount of pressure on each joint because we're living underneath an ocean of air. When a low pressure system or when the weather changes, if you have joint issues where those joints can't readily transfer that pressure, then all the joints start to explode, or expand out, and that creates intense joint pain. So how do people get out of that joint pain from the low pressure system moving in? They open and close the joints, and that allows the fluid transfer. And that is going to be the key to allowing the joints to adapt. But if your blood is healthy, you're not going to experience that. And you can get better. That is the solution. Physical, chemical, emotional stress, and you can get better. Now, if your question wasn't answered in this video, please visit the Dr. B VIP, because I am limited. There's some questions I can't answer. Now, if you can, get on the Dr. B VIP, and I'll go into greater detail on that. And please, thank you for subscribing. Share this video. God bless you all. Stay healthy.